HIV testing, stigma, and discrimination are among the 6 factors that discourage persons from getting tested for HIV/AIDS and continue to be deterrents in achieving the Sustainable Development Goals to end AIDS as a public health threat by 2030. But how will this target be met? Well, health officials and partner agencies plan to scale up HIV preventions, testing, and treatment services with the goal to significantly reduce new infections. Locally, since 2009, that number had been on a downward trend, except for 2015 and 2016, respectively, where there has been a minimal increase.
2020 is where you would want to have 0 new HIV infections. That's at least the target. We did start to have a decrease from 2009 up until 2014. In the last 2 years, we have had a slight increase, not significant. We are still noticing, however, that people are coming into the system rather late, which is a concern. I mean, people are testing way too advanced in the disease.
But while the topic centered on the HIV healthcare system, presenters also spoke on barriers such as legal, human rights, social, cultural, educational, and religious aspects. One such legal aspect was the ruling on Section 53 of the Criminal Code and what it meant for the national HIV response.
There's also a political declaration that we all agreed on. And there, no doubt, we need strong leadership to take on. We know recently we had the issue of the Section 53 judgment, and there was a lot of negativity and almost a lot of discrimination, because even our Canon Flores can attest to being attacked and members of our LGBT community being attacked and so on. So really, it's a matter of leadership. We have to be strong, and because if we do the right thing, we'll get where we need to go. So the whole response needs strong leadership, and we need the engagement of persons living with HIV, obviously, because they are the ones who are feeling it and can tell us what's happening to them. And of course, our communities and the civil society. The declaration suggests that proposes that we have 3 goals. We need to reduce new infections to fewer than 500,000 globally, and also reduce AIDS-related deaths to less than 500,000 globally by 2020. And of course, we need to be able to see what is the extent of stigma and discrimination being experienced by our societies and our vulnerable populations.
Among the targets in anticipation of the 2020 goals are increasing the number of persons being treated for HIV/AIDS, pushing prevention outreach, stopping new infections among children in mother-to-child transmission cases, and focusing on women and youth, as well as gender equality. But what is the Ministry of Health and partnering agencies putting in place to ensure that there is an ease of access to healthcare services?
I think since 2012, when we started realizing that we don't have a generalized epidemic, it's a concentrated epidemic, one of the things we started to do is go in search of men proactively. Men in general, we didn't ask for any specifics in terms of their sexual behavior. One of the other aspects we are now looking at is trying to see if we could expand the testing services. I know the VCT site in Belize is looking at the possibility of doing testing beyond the 8 to 5 hour, possibly going up to 9 o'clock. There has been outreach where the HIV program has gone out to do testing where there's parties that are exclusively for men, gay parties. I think we have taken a more proactive approach to that. We are trying to see if we can place everybody on treatment as well, as long as you're HIV positive, placed on treatment regardless of CD4. Providing condoms at all different levels, female condoms, male condoms. I think it's trying to take it from a more proactive stance, understanding where the epidemic is and knowing where we have to go.
Duane, Moody for News 5.